Hello everybody, this is our 8th session. We are going to be talking about how to start building some public health dashboard design guidelines. And in order to talk about that, then we are going to go through some principles and techniques that can guide the design of population health dashboards. And we are going to be borrowing from a general literature in visualization theory in what are the guiding principles for creating dashboards in general. And we're going to be extrapolating those theories into the specific of the population health informatics and the population health dashboards in our case. Then when we talk about dashboards, the definition of Stephen Few is basically this a visual display of the most important information that we need to achieve one or more objectives. And basically, that information is consolidated and arranged in a single screen in such a way that we can monitor that data, that information, with just a single glance, with a single view of that. And this is the definition of that. And think that we have dashboard is this integration of multiple visualizations that are going to be telling story, that are going to be organizing the ideas in such a way that we can quickly obtain that glance of what is going. What are the main characteristics of dashboards? First, that they are visual tools, that their task is to summarize key information, and this is really important about summarization. It's not all the extent of the data, it's not going into deep analysis, it's just summarizing what is going on, it's giving that an insight that is basically oriented to a particular question, and that insight is meeting a particular objective. We already have a task, we already have a question, we already have a particular problem that we want to solve, and then we are targeting the answer in that direction. But when we ask ourselves why do we need dashboards, or when the answer to a need of the user is a dashboard, then the first question is our user dealing with a large amount of data, and that's data is coming from multiple sources. Okay, then if we answer yes, or even if it's not coming from multiple sources, but we are dealing with data, we need to analyze and monitor this data like in real time or quasi real time, but we need to monitor this data. Then we ask for the next question: what type of task are we wanting to do? Hey, do we need to make decisions based on the data? Or we want to track the progress of a process or a progress of something? Or we want to track the state of conditions of dangerous conditions, basically we want to do a surveillance. Or we want to have an action based on some results or some insights, or just the plan or course of action. Then basically, if we have data and that data is being monitored to do one of these tasks, and the answer is yes, basically we need a dashboard. And we can have simple dashboards with a single indicator, and we can have dashboards that are a little bit more complex. But in general, this is the moment where we are thinking that, hey, maybe I need to implement a dashboard, and when we have data, we need to monitor that, and we are going to have an action like make the decision, tracking progress, or looking for alerts. The answer is going to be that. In that order of ideas, then we are going to be introducing basic and common principles and practices for designing dashboards. And as I said at the beginning, this is from the general practice but it's something that definitely we can extrapolate, and we are going to provide more parallelism into what population health requires. Then the first step, and those that have taken the class in system design, is to consider the audience. We need to consider our audience, we need to consider the user. And what do we need to consider there then? Basically, who is the people that we are going to be talking to, or who is the people that is going to be doing the monitoring, who is going to be interacting with our visualization, with our dashboards, what is the language that they use, what is the reading level, what is the cultural context, what is the background, who are they, how do they relate with data, how they understand the world, what type of limitations they have, because this is going to inform us a lot of the complexity or the simplification that we need to put into place. The second step that we need to have when we are designing a dashboard is to establish our goals. Why we want to have a dashboard? And we already saw that dashboards are the answer to some situations. But when you determine your goals, you need to understand which is your data, what is your data, how is your data, and what is the task. And is this is and regarding this task, as we saw, we are monitoring something, we are going to make a decision, we want to know what we want to measure, who is going to measure it, what is the time interval that we are going to be using to measure that, because that's going to talk about that. And we need to understand the data, we need to understand the task, we need to be able to accomplish the task with the data that is available, or we need to think about what is the transformation of the data, what are the different processes that we need to have, or what are the additional sources that we need in order to complete the task. And then we need to put in place a process that we assure that we have the measurements, that we have that public that already defined, and then we can create a connection there and define what is going to be the interval of those measures, because that's going to create workload in some place of the pipeline from the data collection to the display. Then that's something important. Then once we consider our audience, we establish our goals, what are going to be the tasks that we're going to be performing, we understand the data, we need to start creating the story. And we already have a class in storytelling, no? And here are some examples in how to tell stories. And this is telling us the genealogy of the pop and rock music. And we can see the evolution from 1955 to 1978, and how we have different musical genres or musical tendencies, and how they were evolving, starting from the instrumental R&R, the chop rock, rockabilly, vocal rock, ballad R&B, the jazz rock, and how things are evolving all the way until the the heavy metal, or the acid rock, or the pop rock. Then basically we have all the genealogy of the rock, and this is an interesting visualization that we can see who influences who, or in which years they were active, and how are all these interesting styles and divisions of the rock. And that's one way of telling stories, no? And as you see, it's not the standard visualization that we have, but it's an effective way of showing that. Or the traditional Charles Minors and the Napoleon March to Russia that we have discussed previously is another example of that capabilities of storytelling. Or examples like this one that allows to visualize the common activities, the daily routines of famous people, and they are telling us stories of the day by day of the of famous individuals. This is based in a book. The book is called the Daily Rituals, and then this another author just took the book and graphed those stories. We can see, for example, when the famous people used to sleep, and some of the people slept on the night, like most of us. Some of them have naps, but also we can see how was their creative work and in which moments of their work they were active, and we can see that some of them really took breaks, others were more productive in small chunks of the day, and others have long production times. Also, a lot of them they have real daily jobs or administrative work on top of their creativity, and they're dedicated some time, some more than other ones. Important aspect of the life of people, food and leisure, and exercise. And now we can start seeing some interesting health profiles of these famous people. And interestingly, they didn't exercise that much as we may recommend nowadays, and maybe that can have some conclusions about the history and the health of these individuals in the history. But as you say, you can have a visualization, an interactive visualization, that just by navigating you are gaining a lot of knowledge and being really interactive and tell stories. The fourth step that we need to have as a principle is we need to provide a context, and we need to anchor the users when we are creating our visualization. And the first thing is we need to have descriptive titles. We need to say, hey, what we are talking about. And you saw that these different representations that we have, they are clearly focused on we are talking about this, and this dashboard or this visualization is telling this type of story. We need to tell the people what you are looking at, what type of data we are looking at, and intuitively what is the target, or if I have a metric that I want to contrast, how I'm going to measure those metrics and what they mean. The other aspect that we need to take into account is that we need to provide immediate access to the most relevant information. We don't want the relevant information to be deep down or hidden within our dashboard or our visualization. We need to have that right away. And for that, there is a rule that they call the 5 seconds rule. And the way that you can test it is you look at your dashboard for 5 seconds, then 1, 2, 3, 4, 5, then you look away. And this is the test. If you remember the specifics of what is important, you are good. If you don't, then you need to rethink the design of your dashboard. And basically this is challenging, especially is going to tell us maybe we cannot provide a lot of information in a single screen, we cannot provide a lot of elements there. And one aspect that comes here into play is our limitation of our working memory. Our working memory, they talk about that we can only store in our working memory between 5 and 9 chunks of information, or we can do operations in 5 to 9. The average is 7 plus or minus 2, that's why 5 or 9 is what the regular human brain is able to maintain in these small interactions. Then that's telling us maybe we need to be within that, within 5 to 9 pieces of data, pieces of information that we are building in the individuals in order to be efficient. If you are towards the 9, it's going to be harder to retain that information, but if we are towards the 5, it's going to be more successful, but in theory we can be around 7, and you will test it because sometimes there are chunks of data that are easier to remember than other ones because we can anchor our memory in different ways. The sixth principle is that we create a logical layout, and that logical layout is also called the funnel or the inverted pyramid of information, and it's also recommending when you are writing scientific papers or when you are telling stories. We recommend using this type of approach that, as the name saying, is a funnel, is wider on the top and narrower in the bottom. But what is wider? The most relevant information goes in the top, and generally more general information is aggregated data. It's an indicator or a key measurement. Then we have supporting or important details that are going to explain that indicator that we have. And finally, we provide general or background information that is going to be feeding into those important details. In order to understand this a little bit better, use the really well known World Health Organization COVID map. As you see, this is the first thing that we look into the map. Then we see the color density, and then we can see where are hotspots quickly in the world just because the intensity of the color. We have the basic numbers, and these are a coronavirus dashboard overview, and globally, as today at this time, we have more than 624,000 confirmed cases of COVID, including 6.5 million deaths. And as you see, then it's really an overview and a big view of what the dashboard is going to be telling us. Then we have a second section where, based on the same numbers that we had that are here, and this number is just showing us the history, the evolution, what is happening. And the same is telling about the deaths that are the main indicators. And then we can see when the different waves that we have of the pandemic occur, and how the incidence of cases and the deaths are related, and we can start making our own conclusions, and then we can go into a really more detailed situation and just split this into the different world regions, and this is what is going to be supporting or giving us background information, and maybe we can have the hypothesis where are the sources and how Europe is leading some of the peaks, and in some moment was the Western Pacific that was being the one having the influence, or when here in the America we were the ones providing a lot of those cases. And the same happened with Jon Snow's cholera map, that this is traditional one, and this is a single view, it's a single visualization and almost a dashboard, because you have your bars indicating the frequency of cases by residency, and then you have the different you have the bars here indicating and the different location of the water pumps, and then you can see like proximity, how there it could be a cause relationship, and then we have that aspect of relationship and quick glance of the history, and having a layout that is telling us, oh, I'm looking into details until I'm going into more detail. The other thing is we don't need to place all the data in a single page, even though we recommend to have as much of the data, of much of the visualization, but the core of that data in a single page as a dashboard. This is allowing us to open the probability of the drill down interactivity. And as you saw, then we have the behavior of the COVID pandemic in average, 7-day average, but we can look into what is going on in a daily basis. And of course, it looks similar and it has some dips that when we zoom in, they are in relationship with the weekends, because weekends we don't report the same numbers and they are going to be concentrated in the following Monday. And that's why we have this behavior of the data that is more like a saw that and a smooth graph, but it's telling us stories, telling us dynamics, it's telling us different things. And we can go also from the daily measurement and do some transformations, and then instead of looking at the absolute numbers per day, we can see the cumulative of cases and look that we are using exactly the same data, just changing the representation and the transformation, and we are having complete different insights, because now we see what are the proportion across the world in the different regions in the total of cases and how the disease has been accumulated over time. And of course here this allows us to see when the peaks occur and where and who were contributing to those peaks. And two different questions, two different representations, but we don't need to have everything, all the answers right away in the first page. That's why we can add the interactivity layers in order to allow the user to deep down and explore a little bit more. The other thing that we need to have clear is the type of dashboard that we are going to be using. And you are wondering, what is a type of dashboard? And literature refers that basically are 4 types, basic primary types of dashboards. The first one is an strategic dashboard. A strategic dashboard usually are for long-term decision making, is to overview processes that changes slowly in the time and allow us to plan interventions in the long term. Then, like the health observatories of the WHO, those are strategic dashboards, because we have historical data, we look into the behavior of diseases, and then we prioritize what are going to be the diseases that we are going to be dedicating resources and trying to tackle. And when we have those strategic dashboards is when we start to see these neglected diseases, because for some reason they don't appear in the general map, but they are really important to specific populations. And sometimes those strategic views, depending of the granularity of the data, is going to be different. Then we have the tactical. The tactical are more in the middle range decision making process, is to adjust things in order to achieve some outcomes. Then for example, if we are comparing vaccination rates or uptake of the vaccine, or if we are measuring even vaccine hesitance, things like that are more in the tactical domain, because we can map where the people is receiving, where the people is not receiving, and maybe make decisions in the next level, that is the operational level, where we are going to be sending our resources. And the operational level is basically in the daily base, how things are going on and what adjustments do I need to do in my process in order to keep my organization moving forward. And if we take examples of the clinical domain, for example, is the bed occupancy of a hospital and the bed rotation that we have, that's in an operational level. but we can make that operational available in case of a disaster or emergency or a network in order to know where the resources are available. And there are the typical analytical dashboards that are more to obtain information and create hypotheses and try to do other interventions, and they are not in direct relationship with our response, but more in the just understanding what is the dynamic of a problem, like COVID, for example. Those are analytical dashboard, and we can have these different levels, but also being the platform for domain specific. Then we can have healthcare, or within healthcare we can have a particular disease, or we can have a particular problem that we want to be talking, and then that's another level of that is going to add for the basic types, because maybe we want to target not only some kind of user, not only some kind of needs of tasks, but now we want to target a specific domain or a specific platform where we want to solve the issues. Now, the ninth point that we already have discussed as well in previous classes is use the right type of chart. And remember, depending of what you like to show, you choose the type of visualization. And we have several guidelines, we already went over there, but to remind you, the basic tasks we want to compare or to show relationships or to create some compositions or to show the distribution of some data, then we use different representation, different visualization, and there are resources to do that. But yes, we need to select the right visualization, because if we don't have the right visualization, that message that we want to convey maybe is going to be deviated. And we need to be careful how we choose the layout that we are going to be using. And now it's not the logical layout, this is the actual physical representation layout of the solution. And then we need to think about the visual patterns, and here we have two examples of the most common visual patterns that people follow, and this is going to help us to think where I'm going to put the really important information. And the traditional visual patterns, especially to the people that write from left to right and top to bottom, are going to be in the Z pattern hierarchy or in the F pattern hierarchy. And how did they work? Then the Z pattern, we go from the title, and then we go to the next big element that is attracting our attention. And as you see, usually we are going to ignore this element or this component, and maybe that's going to be invisible. Even if we put some advertising there, it's going to be invisible, or it's going to be competing with the actual information that we want to present. But in this case, the titles are helping us to follow that C pattern. And the F pattern is the most common. Then we go in the title, we go through the column in the left, and then we go towards the content. And these are some visual tracking experiments showing people how they look into a Google search or into a web page or another representation. And then we need to think about that. Where are we going to locate the most important information? Then we need to try to use the headings and use the anchoring points that people is going to be using. And the other important thing is, in that layout, we can consider using metaphors to represent our thinking. And there are several templates and really interesting tools out there For example, press is a metaphor driven visualization tool, or this one that is information is beautiful. You can use these ideas as templates in how you're going to represent your data. Then, for example, we have this about biodegradable, comfortable sanitary pads, and you see that they are actually using the visual representation of the sanitary pad to represent data, or the power of the word clouds, or the, we already know the map is really good for mapping elements to do geographical visualization. And there are different things that we can be using, and there are a bunch of these cool representations of data that we can consider as examples that can help us build our visualizations and convey a message. This is an ongoing research topic, even though we have traditional, well established representations in the visualizations that we have studied. Every day we have some metaphors and other ways of showing data that are more relatable to the people. The other thing that we need to do is to prioritize the simplicity. Less is better, or the KISS principle. Keep it simple and short. That's a really important thing in design. Less is better most of the time, because we don't want to confuse the audience. We don't want them to get distracted. We don't want them to not be paying attention to what we really want them to focus. And in that order of ideas, this is an example of a not so good visualization, and this intended to be a London dashboard, and then we have weather, we have multiple sources, we have the actual weather in the airport, we have the forecast by Yahoo, then they have a transportation metrics, and within those transportation metrics, then we have the tube, and we have the bike sharing use. We have environmental data. Now they have information about the river, and cameras, usage of the electricity grid, and we have so many things that what is the actual question? What are we answering here? Maybe if we segment things and just have a dedicated thing for weather, to have a dedicated thing to the transportation, is going to be easier, or have the indexes and how the topics of summarization, for example, have a single indicator of weather, and we can drill down and see more specifics. Have a single indicator of how is the general transportation mobility in the city, and then we can drill down and see the sources. How is the environment? Just a single indicator, and we can have the drill down. That could be a way of simplifying the representation, but putting so much things there is going to be really confusing, and for sure this is not going to pass the 5-second test, because first, we don't know what is the most important information that we are supposed to extract from here, and it has more than 7 plus or minus 2 elements that we are not going to remember anything that is in this screen easily. Other practice is in the visual representation is how we round, and the recommendation is to round our numbers. Why? It's much more easier to look into small concrete compressed numbers. 640k is much more easier to remember anchor and understand that 640 0 10 35 cents, especially in this range. Maybe this 10.35 are going to be negligible. Even though this recommendation, we see that the COVID dashboards, for example, they use exact numbers, but it's because we started using them as an indicator accounting, and every single life, every single case counts in that regards. Then, but we don't count decimals, for example, in that case. Then that's already there. But unless you really need that decimal to make decision, it's better to compress your data as much as you can. And the same apply for percentage. 4.3 practically is the representation of 2.2483%, and that goes again, what is the precision that you need in the decision making process, and how much you can compress and you can round your numbers to make them easier, to make them recognizable in a easiest way. 13, we need to be careful with color. Color, yes, conveys meaning. We have discussed about color, but when we use that, we need to use the color in a really meaningful way. The dashboards are already loaded with data that are trying to convey information, and if you put a lot of color there, then you are going to create a lot of noise. Then when we are talking into the visual, thinking about the visual design, we should avoid the excessive decoration. And we already said, keep it simple and short. And every single element that we are putting there, including color, it needs to have a meaning. It's not because it's cool or fancy. No, if you are using color, it's because color is providing some meaning. And you see that color can be used to distinguish between different categories of information or to draw attention to a specific data point. But when we have this resolution, it's really difficult to know really what I want to see, because in the resolution of cases by city, I'm losing information. Maybe I just need to go cases and representing the circles by country instead of having this data by city, unless I have a better resolution. And maybe a better representation could be something like we have on the right, that we have the cases and the color is conveying that information about the density of the color in the different countries, and we have presented this in the general rules of visualization. Remember that red and green, they have positive and negative values, and they are valid to use, but they can be problematic for the colorblind users. Then please don't use color as the only denominator of meaning, especially if they are green and red, and we may consider combining them with labels, icons, something else that make them different. Or, much better, use blind friendly palettes. It could be blue and orange, or there are other different palettes that are available, and we can experiment, for example, in Tableau with different properties and see different better representations to do that. And this is an example of using the blue and orange, where blue is going down and the orange is going up, and this is about population growth, and it still conveys that meaning, especially because the other representation that we have in our brain, that blue is cold and orange is hot, and hot is higher, cold is lower in our mental schemas, then this is really easy to for our brain to understand this type of palette. Then we can see where is more decrease and where we have more increase of population, for example, in a quick glance to this representation. The fourth principle or practice is use the size and position to make priorities. And remember that we already have the the layout, no? And then we can explode the layout and the size in order to make things more to make things more apparent to grab attention. You see that basically the numbers of total cases, deaths, and vaccines, they are in an a font size that is bigger in general than the other ones, and it's in the top position. They are dragging our attention. Okay, this is what we want to see. This is the indicator that we are using here, and it's clear. Okay, this is huge. And then we have a secondary data that is supporting this, and is the last month, uh, how big has been the change. And now we have the supporting detail for the data that we are seeing. And the other thing is here we see the consistency in color. Then red, now we see that's cases, 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 cases. Those are cases. White is dead or are dead. Then deaths, 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 deaths are in white. And green are vaccines. And those vaccines are not represented yet in the cases daily in the country detail, but eventually it's going to appear in the maps. But then now we see how position, how size, and even how color is conveying meaning. And in this case, red is not meaning that is necessarily bad, or green necessarily that is good, even though it's kind of an implication, because vaccines, to be vaccinated is good and to be sick is bad. But in reality, it's because if you remember historically, this dashboard was born having the red indication for the cases, and just the vaccines were included later. Then they just use a contrasting color for that, but be meaningful that maybe this is not as useful for colorblind people, because they are not going to be able to do the matching between the different elements. Then don't abuse of real-time data, of abuse of refreshing your visualization. Remember that we need to be clear in what is the goal, what is the audience, what is the type of story, what is the context that we are working on, what is the type of dashboard or the level of interaction that we have, and that's going to be informing the frequency of refreshment of the data. Sometimes we need to do that every hour, sometimes we need to do every day or every week, month, quarterly, yearly, but we need to have a clear task, a clear decision, because if we were looking into the London, maybe yes, we need the weather and the traffic every hour. But if we are looking into COVID, having that daily and even weekly is good enough. And in other observations, maybe just the monthly, the quarterly, or even the yearly variation is what is going to be really important, and it depends of the dynamic of the phenomenon that we are observing, and the how fast we can act and modify the behavior of what we are surveying. The other thing is we need to be consistent, and there are different layers of consistency that we need to have into account. First is the visual consistency, and we exemplify that a little bit with the Johns Hopkins, that every single type of data, they use the same colors to be represented. The other thing is be consistency in layout, in the way that we are putting things, especially when we have labels and when we have different representations. Remember in the Johns Hopkins uh, representation, we have that always we go cases, dead, and we are kind of consistent in that way. Interesting here, there is an apparent inconsistency because if you see, we start with total cases and we follow with 28 days. And if you look here, it's inverted. The total is below and the 28 days is on top. This can induce errors on interpretation of the data. This is actually a layout inconsistency that we can point out in the in the in the representation. Even look, the 28 days is bigger than the total, and it's not clear why they are doing this differentiation, because there is no indication for the reason of making that separation, for example. Then that's something that we need to be uh, mindful. And also content needs to be consistent and consistent with the word. 17. Don't be afraid of using interactive elements. We already showed the transforms, we already showed the drill down, and those are really important elements in order to amplify the experience of the user and be more mindful. And for example, just those tool tips that we can have on the map when we are hovering, they are really useful, because can you imagine putting all this data on top of every single country? That's going to be really messy and we are not going to be able to read. But if we have that interactivity that we are just exploring and drilling down just by hovering, is going to provide a much better experience to the user. We can when we have animation options, we can use them, but be careful. Excess of animation is just going to be distracting, and sometimes it's going to be annoying to the spectator. And an example that we have show in the past is the way that we have data representation in our health in data. And remember that we have historical representation that we can animate, and we can have that animation and actually have a better understanding of a phenomenon. In this case, until this moment, is who was recording data, no? Even though we are talking about life expectancy, we can notice that the world was not recording data until almost the beginning of the 20th century. And there were even some countries that were not collecting data. But we see now that they are collecting data and there is an explosion in the life expectancy in years. And it has been growing and growing and growing after that. And it's interesting how the initial life expectancy of the world was below 54 years, and now we have countries that we are getting close to the 90 years. A lot of information that we can extract from visualization, and that is supported by the animation itself in the way that we can extract the data. The 19th recommendation is double up your margins. Don't be afraid to create a negative space. Negative space are all these white spaces that we create between elements of visualization, and they help us to separate especially the different elements. It's better to use the negative space and not having a lot of lines. If you start imagining the lines here, those lines are going to look busy and they're going to be distracting. But the white space is even more powerful sometimes the negative space in creating that separation, in creating that space, then that's going to be really, really pleasing to the user to have spacing. And of course, that spacing needs to be consistent. Then we know what goes with what, and we are going to be able to extract that information. And nowadays, definitely we need to optimize our visualizations for multiple devices. We don't need just to test our visualization in a single device. We need to experiment with different layouts and see how they look in different layouts. And this is the famous World Health Organization COVID dashboard in the web version and in a mobile version. And for some reason, yes, they were using the white space, but somebody forgot to delete some spaces. And look, in the first screen, we are missing some of the important data that we have enough space. And then in this case, this use of white space is a waste because it's not creating a really a good function, and it's just wasting this when we can have, because we already have the line, we can have just the line and then have the data that is going to perfectly fit uh, in this place. But yes, we need to test our interfaces and how is going to be the mobile compatibility. Most of the exploration of the web and the information in the world nowadays is being done by mobile devices, not by desktops or big screens or double screens that we have sometimes in our offices. The other thing is consider exporting this actually to a paper base and not necessarily having a digital dashboard. And that's possible. This is a poster that shows us how we can have interactive paper dashboards. And this is an example in a health facility where they have a reusable paper-based dashboard for the cervical cancer prevention. Then they have their graph bar, they have the line bar, they have a graph bar, and they have some indicators that they are just drawing in the way that they are occurring in the poster, and they are creating an interactive, real-time, paper-based dashboard. And maybe sometimes this is what we need. The public is right there, easy to implement, easy solution for the community that we want to solve the problem. Maybe at the end of the month we can take a picture, erase it, or print a new one and go from there. Then this is something important to think. Not everything needs to be an electronic visualization solution. 22. Keep graphical integrity. And I have talked about this a little bit before, and I have insisted that we can lie with graphics. Then Tufte's 6 principles of graphical integrity says that we need to have proportionality, label consistency, right measure, data dimensions, and context. What is this? First, the proportionality talks about that the numbers, the representation of the numbers, they need to be proportional in the graph. There should be a direct proportion of the number quantities that we measure into the graph. We don't want to have weird proportions or representations, and then we need to be careful when we are using logarithmics or different scales that we can use in order to amplify differences, but actually we need to be sure why we're using them, and not just because we want to create a false difference or hide a difference, but really that we are using the right proportion to display the data in the best way that we can interpret that. And that's what this says. Labeling, then we need to have a clear, detail, and thorough label of what we have there. And we don't want distortion or ambiguity. Writing out explanations of the data on the graphic itself. We have seen how a lot of visualizations are annotated. They highlight things. Then we need to label those important events in data, how we explain them, especially if we want to grab attention to those elements. Consistency, we want to show the variations of data. We don't want to show variations in design. And that applies, for example, when we have the same variable in multiple observations, then we don't change the color of the observation. We don't change the color of the variable. Every single variable in different observation is going to have the same color. What we can change maybe is the representation of a different variable with a different color, and we saw that in the John Hopkins, that every single variable they were assigned a color. But don't go putting a different color in different sections where we are referring to the same variable, because you are going to be creating a mess. Or imagine just the top is green, the bottom, the center is yellow, and the bottom is red, but you have the same variable in the three sections. You are going to create really confusion and break the integrity of the graphic representation. The fourth one is the right measure. Then this is just a financial example that we have there, but definitely we need to look what is the best way of representing uh, data. And for example, is better to have the daily measurements of COVID, or is better to have the 7 days average? And what we are representing then? And what are the type of conclusion that we can have? And what is the kind of noise that we can create? And the discussion and just asking the users and the interpretation is the one that is going to tell you what is the best representation, or even how you select the right measurement that you want to display. Remember that human beings are really, really bad managing proportions, and even worse, managing probabilities. Then we need to be mindful of those things. And we are more concrete. We don't think in fractions. We think in integers. Then we need to take that into considerations. The other thing is the data dimensions. Then you don't want to have more variables than observations, because then that's going to look weird, no? Then usually the number of information carrying or variable dimensions, that should be no more than the actual things that we are measuring, because if not, you are going to have a mess. Or we are in the domains of big data, especially when we have multidimensionality of data, we can have more variables that actually elements that we are observing, and that's something that can easily happen when we are applying big data, but maybe it's not the best thing to be representing directly unless we have some kind of filtering and processing before in order to present that. And context, we already talked about the context, about the title, about the telling what is going to happen, what is the target, but we are not putting any data that is out of context. We are not bringing extraneous data or things that are not related, because then we are going to create a confusion, and we are going to misdirect our audience. The other concept is to have white labels and embedding, and this is related with the capabilities that we have tools that can help us to produce visualizations, or we can reduce other visualizations or do some filtering, and then we can embed those visualizations in our tools in order to present data. And then the idea here is to reuse and recycle. We don't need to recreate, for example, the life expectancy graph and that dynamic graph from scratch if we want to use that in a presentation or in a visualization, or this is supporting something in a dashboard that we are using, for example. And we have the function of embedding. Then we can have this piece of code, we can put this within our visualization, and we are going to have access to the same experience user, and we don't need to redo that. We are going to preserve the references, we are going to preserve the link, but in some way it's going to be a white label because we can frame this around and give the user the experience that they are in our context, and then we can use this graph to support other type of visualizations that can be related, or we can just take those data sources and transform in some way that we can make some stories based on these elements. And this is a valid way of using and recycling, because we are just embedding, we are not copying and pasting, we are using the actual tool and its reference and is being pulled from the origin, just that they are giving us the option to reuse and recycle. Then that's an advantage of some of these uh, practices. And if you can do that, if you can recycle it, you can embed, why not? You don't need to do everything from scratch, because you may have noticed, you may have learned that this is time consuming, this is resource intensive, and you need to invest uh, time and thinking and design. Then if somebody has done a really good job, then think about that. And I have also told you in layout, yes, go and get inspiration. Don't just knock it out because maybe your data is different than the data of the other person, but use that layout and go from there. Now, avoid the common mistakes. Then we pointed some of them already. Color that is not conveying any information. For example, here, what are the colors? What is that meaning? What is the scale? How do I interpret even these colors? And this may be making sense because these are the tube line, the subway line in London, and then it's familiar for the people there. But maybe this is better to have the map, and the map to show an overlying layer showing the status. I don't know. But be careful with color, because color conveys meaning, and use that in your advantage, not to make things more complicated. Incorrect calculations is a common mistake, and then of course bad calculation, bad transformation, bad output. In our second assignment we need to do some calculations, then be sure that you are doing that correctly. If you are in doubt, please ask. We'll be more than happy to help you with that. Wrong visuals. The wrong visual for the type of data that we're using is really common. Then review it and just test it with your users. That's going to give you some clues if you are really providing the right information to your intended audience. And too much data, yes, you don't want to overload your audience with data, because then it's going to be unproductive. We already use that not as good example of what a dashboard should be. And as always, never stop evolving. This is a complete cycle. Always evaluation and feedback is important. Ask your users how they are feeling, receive that feedback, and implement corrections. And ask the users again and receive your feedback. Be open to that and implement. Because at the end, you want to be conveying a right message, and you want to close this circle. Then we have 25 common principles and practices that I have presented to you today. This is an aggregation of different recommendations. There are literature with 20, 10, 5. Then I try to summarize them in a comprehensive way. And we see that really doing dashboard for healthcare is like doing dashboard for any other industry. What is different is our audience and our domain. and we need to be careful with that. And of course, the data sources and how we manage those data, because our data sometimes is problematic, and the way that we present that is going to be effect on people's lives. Then here are some resources, and I left you in the website more resources as well, and most of the things that I have presented are linked from the PowerPoint, and they are available also in the website, in the class. Thank you very much for your attention, and see you the next time.